Once again, you are welcome to Angel Health Academy. Subject: Community Health Nursing, Mnemonics. Topic for the day is Dimension of Health. Health Dimension. The meaning of the word dimension means measurement. Thus, dimension of health is measurement of health. Otherwise, it is called as levels of health. Health has many dimensions. So, health is multi-dimensions. As health is influenced by number of factors, that factors comes under dimensions. We measure all those factors which influence the health of a person, that is known as dimension. So, in simple, dimension is the measurement of the health. It is also known as levels of health. Then, generally, health is multi-dimensional. The World Health Organization in 1948 defined health as it is a state of complete physical, mental and social well-being, and not merely an absence of disease or infirmity. Infirmity means weakness or disability. So WHO has given three important or major or specific dimensions in this definition, that is physical, mental and social well-being. So according to this definition, health is a state of complete physical, mental and social well-being, and not merely an absence of disease or infirmity. So absence of any disease or absence of any disability, absence of any infirmity doesn't mean that the person is healthy. It only means when a person is having complete state of physical, mental, social well-being, then only according to WHO the person is healthy. Thus, in WHO definition, they envisages three specific dimension or major dimension, that is PMS. Physical, mental and social dimension. Physical, mental and social dimensions. Next is dimension of health. To understand the dimension, we can see a human body and we can classify human body as head, trunk and extremities. That is upper extremity and lower extremity. So to understand the dimension of health, first we can understand the parts of the body. Thus, there are 7 important parts in human body. First is head, second is trunk or body, third one is upper extremity, that is arms, and fourth one is lower extremity, that is legs. So, to understand more about dimension, we can include in head, brain, and in trunk body, the heart, and in the lower extremity, the foot. Now, you can remember these parts of the human body and we can convert the dimension of health. When we measure the health of the person, we have to include all these important parts. Let us see what are the dimension of health. Broadly, the dimension of health can be included 7 dimensions. They are, first is physical dimension. The trunk of the human body can be considered as a physical dimensions, the build of the body. Then second dimension is mental dimension. The head can be mental dimension. Then third is the upper extremity. We can consider as that is social dimension, upper extremities. Then the brain in the head we can consider as a emotional dimension. Emotional dimension. Then the heart in the body, in the trunk, you can consider as or we can consider as a spiritual dimension. And the lower limbs or lower extremity we can consider as the vocational dimensions. That is vocational dimension. And last, the foot we can consider as other dimensions, others. So there are 7 important dimensions. That is, one is physical dimension, second is mental dimension, third is social dimension, that is envisaged by WHO, and other important dimensions includes emotional dimensions, spiritual dimensions, vocational dimensions and others. So in this way you can understand the important or major dimensions of health. Otherwise we can have other one concept to discuss about dimensions of health. So the dimension of health also can be considered as a box with 7 parts. The lower part of the box you can consider as one, that is physical dimension, and the side one part you can consider as a mental dimension. The left side you can consider as a social dimension, and the opposite side of the mental dimension you can consider as a spiritual dimension, and opposite side of the social dimension we can consider as a emotional dimension. The top 2 covers we can consider as the vocational dimension and other dimensions or others. So this is another concept of dimension of health. It is like a box with 7 parts including the top covers. So we have physical dimension, mental dimension, social dimension, then spiritual dimension, emotional dimension, vocational dimension and other dimensions. You can understand the dimensions without a mnemonic, but if you need, you can use the mnemonics. I have made the mnemonic as PM said save others. As you know, now the present scenario and situation is the COVID-19 pandemic. So our Honorable Prime Minister Narendra Modi said save others with the vaccines, Covishield vaccines. You can just note the spelling of save. Instead of SAVE, I have made just SEV. So PM is the short form Prime Minister. PM said save others. Let us expand that. P stands for physical dimension. M stands for mental dimension. Then Z stands for social dimension. S stands for spiritual dimension. E stands for emotional dimension. V stands for vocational dimension. And other stands for other dimensions. Thus we have 7 dimensions. So let us explain in detail about all these dimensions of health. First is physical dimension. Physical health implies, or it means, that is perfect functioning of the body. That is perfect functioning of the human body comes under physical dimension. That means health biologically a state or physically a state in which every cell, every tissue, every organ, every system, 12 systems is functioning at optimum capacity or maximum capacity and in perfect harmony, balance with the rest of the body parts. So physical health implies or indicate that is perfect functioning of the body. That means all the cells, tissues, organs and system in the body functioning at a maximum capacity, optimum capacity and with the perfect harmony with the rest of the human body parts. The physical health can be achieved by 6 important activities that you can have a mnemonic like health. H stands for healthy diet. E stands for exercise, that is regular exercise or by regular exercise. A stands for adequate rest and sleep. E stands for spending leisures, that is enjoying the free time. Then T stands for treatment, early detection and treatment and taking safety precautions in relation to health and regular follow-up with the healthcare members. So regular follow-up. Then H stands for hate smoking or alcohol intake or avoid smoking or alcohol intake or no smoking and no drinking. So this is health. With these 6 activities we can achieve the physical health. Next is science of physical health. There are 10 important signs of physical health. First one is a good complexion. Good complexion means good appearance, good color, good texture, especially on the face of the person. That is good complexion. Then a clean skin all over the body. Then third one is lustrous hair, smooth hair. Then bright eyes. Then body with a well-clothed, firm flesh. Very good firm flesh in the body. That means not too fatty, normal built. And having a sweet breath and good appetite, good hunger. Then sound sleep or good sleep. Then regular activities of both bowel and bladder. Normal regular activities of the bowel and bladder. Then smooth, easy and coordinated bodily movements, especially on the joints and skeletal system, muscles and skeletal system and others. Let us see what are the other signs of physical health, which includes all the organs in the body in normal size and normal function. That is perfect functioning with the normal size. All special senses are intact, smooth functioning. That is our vision, our hearing, our smell, taste and touch sensation. The 5 senses are intact and smooth functioning. The next is vital signs, temperature, pulse and respiration within the normal range of the person according to or in relation to his age and sex. Last one is a steady weight gain, normal weight gain, especially in young and growing children until he is become adult also. This will be continued as a normal or steady weight gain. These are the other signs of physical health. Then let us see what are the signs of poor physical health. Here I have made a small mnemonic, that is sign of A, B, C, D, E and others. These are the poor physical health. The first one is snoring. Snoring, you know that, making noise during sleep, that is snoring. Then irritability, complete irritation. The person will be always irritable if he doesn't have or poor physical health. Then gazy, problem with the bowel and bladder, that is gas, abdominal problems. Nausea, vomiting sensation. Aches and pains, always body aches, local aches and general aches. Then difficulties breathing difficulty. Then coughing and sneezing, development of addiction with a certain substance, that is substance abuse. Then always you will be tired, every time tired or fatigue. Then other such signs that may indicate the poor physical health. So you can remember this sign of A, B, C, D, E and others. S stands for snore, I stands for irritability, G stands for gazy, N stands for nausea, A stands for aches and pains, B stands for breathing difficulty, C stands for coughing and sneezing, D stands for development of addictions with a certain substance, then E stands for every time tired or fatigue, and last one is 10th one is others. Then evaluation of the physical health. How to evaluate the physical health of the person? How to evaluate the physical dimension? There are many tools and techniques to evaluate the physical health. Mainly it includes 6 tools and techniques. That is, first one is self-assessment of the total body by a person. Then making various inquiries related to his health. Then having a standardized questionnaire and related to cardiovascular system, related to respiratory system, etc. Then clinical examinations or physical examinations, nutritional and dietary assessment, 24 hours recall, that is RDA values assessment, that is nutrition and dietary assessment. Then various biochemical and laboratory investigations to evaluate the physical health. So these are the 6 important tools and techniques to evaluate the physical health. Let us see what all this evaluation of physical health. So evaluation of physical health includes, first one is self-assessment of overall health of a person. Himself he can make an assessment, that is self-assessment. Then inquiry, various inquiry about ill health and risk factors. He may be prone to various risk factors, family history or other genetic related risk factors. So ill health and risk factors. Medications, he is depending some of the medications. So inquiry about medications or into medications. Then inquiry about the levels of activities, his regular activities, the number of days of restricted activities, degree of fitness, etc. all comes under levels of activity. And inquiry about the use of medical services, whether he is utilizing the available medical services, number of visits to the doctors and recent hospitalization if there is. All this comes under inquiries about the use of available medical services. The next is standardized questionnaire, making standardized questionnaire and answering the questions related to cardiovascular systems or cardiovascular diseases and even respiratory diseases, nervous diseases, etc. So that is standardized questionnaires. Others includes nutritional and dietary assessment, biochemical and laboratory investigation. These are the tools and techniques for evaluation of physical health of the person. Evaluation health of the people at community level can be done by or assessed by various indicators. Especially we have crude death rate, CDR, infant mortality rate, that is IMR, and even expectation of life of a person. These are the important indicators could be used as a tool for evaluation of physical dimension or physical health of the people in the community. The second major dimension of health is mental dimension. Mental dimension doesn't mean that merely an absence of mental illness. It is more than that. A good mental health is the ability to respond to many varied life experiences with flexibility and with a sense of a different purpose. So, good mental health is the ability of the person to respond to various situations in the life, experiences he faces during the life with flexibility, that is with adjustment and with a sense of proper intention or purpose. The mental dimension or positive mental health is the one of the key to achieve good health. So it is one of the keys to achieve good health. The mental health has been defined as a state of balance between the individual and the surrounding world, his surrounding environment, and a state of harmony between oneself and others, between himself and other peoples, a coexistence between the realities of the self, himself, and that of other people and that of the environment. So the mental health has been defined as a state of balance between the individual, that is his internal environment, and to the surrounding, that is the external environment. Then a state of harmony, a good relationship between oneself, himself, and with the other people or others. A coexistence between the realities of the self, the real things in the self, and that of the other people and that of the environment is called mental health. In short, it is a balance between the mind, body and spirit of a person, individual, to his environment or its environment. Mental health is a balance between mind, body and spirit to its environment or towards the environment. Let us see what are the characteristics or attributes of mentally healthy persons. A mentally healthy person always will be free from internal conflicts. That means he is not at war with himself. He will be always free from internal problems and internal conflicts. Then second characteristic is he will be a well-adjusted person. That means he is able to get along with the other people. He is well-adjusted. Then he accepts the criticism positively and he is usually not upset with the criticism. Then third characteristic is he searches for the identity, that self-concept. Who am I? He searches for the identity of himself, that is self-concept. The fourth characteristic of a mentally healthy person is he has a strong sense of self-esteem, that is self-respect. That is confidence of one's worth and abilities. A mentally healthy person always confident with his worth and his abilities. So the strong sense of self-esteem. The fifth characteristic of a mentally healthy person is he knows himself. That means self-actualization. He knows his needs, goals and problems. He knows his needs, problems and goals. That is self-actualization. Then he has a good self-control. A mentally healthy person has a good self-control. He balances rationally and intelligently. And he has a emotional control. That is a self-control. Then mentally healthy person faces problems in the life. He faces problems in the life and he tries to solve all the problems intelligently. That is, he always cope with stress and anxiety. Then last 8 characteristics is others. That is, he lives with a balanced life. That is, he is able to maintain a balance between work, rest and recreation. He is able to maintain a balance between work, rest and recreation. So these are the 8 characteristics or attributes of a mentally healthy person. Earlier, the mind and body were considered as a separate entities or 2 separate elements. Now it is discovered that these are interrelated. So the psychological factors can induce all kind of illness or physical problems, not simply mental ones. Thus, the psychological factors of a person can induce all kind of diseases or illnesses, such as essential hypertension, peptic ulcers, bronchial asthma, etc. These all psychosomatic disorders. That is, a psychological factor can induce the physical problems in an individual. In the same manner, some major mental illness such as depression, schizophrenia have a biological component that may lead to physical problems. For example, depression may lead to poor nutritional intake, diet intake, and poor hygiene, maintaining of hygiene. That may lead to decreased immune system and it may prone to have infections. All this later lead to physical illness to the individual. That means some major mental illness such as depression, schizophrenia, etc. have a biological component. Let us see how to evaluate the mental dimension or mental health of a person. There is no specific tool for evaluating the mental dimension, but we have a certain set of standardized tests like IQ test, personality test, mental health questionnaires and mental status examination, MSc, etc. So these are the standardized tests which is used for evaluating the mental health or mental dimension of a person. The third major dimension of health is social dimension or social well-being or social health. Social well-being implies harmony and integration within the individual. So it provides harmony and integration within the individuals, between each individual and other members of the society. So harmony between each person and other members of the society and between the individual and the outside world, external environment in which he or they live. So social well-being implies harmony and integration within the individual, between each individual and the other members of the society, and between the individual and his surrounding and the world in which he lives or they live. The social well-being has been defined as quantity and quality of individuals' interpersonal ties, skills or relationship, and the extent of involvement within the community or with the community. So social well-being or social dimension has been defined as quantity and quality of individuals' interpersonal ties and the extent of involvement with the community. How much a person interact with the society or with his community. The social dimension of health includes the level of social skills one person possesses and his ability to see oneself as a member of the large society. So he believes strongly that he is a member of the society and he has various levels of social skills such as communication, respect, intimacy, equality, social functioning. So communication skill, respect each other, intimacy with other people, consider equal or equality and function as a social functioning. In short, you can make it as a CRIES, C-R-I-E-S, that is communication, respect, intimacy, equality and social functioning. These are the levels of social skills. The social health is actually rooted in positive material environment and positive human environment. Positive material environment means it focusing on financial and material management. That is financial and material management. Positive human environment concerned with the social network of the individual. That is interaction with the group of people. The social network of the individual. In short, we can say that an individual is socially healthy if he is able to maintain an harmonious relationship with other members of the people in the society in which he lives. The evaluation of social dimension or social health can be done by indirect measurement tools, which include sociometry, attitude scale, socio-economic scale such as Kuppuswamy socio-economic scale. Sociometry is a quantitative method of measuring the social relationship, or it is a study of measuring the interpersonal relationship among the people in a group. So these are the indirect measurement tools to evaluate the social dimension. The next dimension is spiritual dimension. The spiritual dimension pertains to our soul or our spirit. It refers to the belief in supernatural powers or aspect of our universe. So spiritual dimension refers to the belief in supernatural aspect of the universe, which helps to seek the meaning and the purpose of the life. To seek the meaning and the purpose of the life, and which helps to solve the internal and external conflicts of the person. Spiritual dimension helps to solve the internal and external conflicts of an individual. Thus, spiritual dimension is associated with religious beliefs, which provide philosophy of life, integrity, principles of life, and ethical values has to be followed in the life. That is PIPE, philosophy of life, integrity, principles and ethical values. As we have already mentioned, the spiritual dimension includes hope for life or hope of life, ethics, love, purpose and principles of life, integrity, charity, prayers. That is spiritual gathering organized to maintain the spiritual health. So spiritual gatherings or prayers and meditations. So you can use the mnemonic like help in charity, prayer and meditation. Spiritual dimension includes help in charity, prayer and meditation. Hope of life, ethics, love, purpose and principles, integrity, charity, prayers and meditations. The next dimension is emotional dimension. Historically, mental and emotional dimensions have been seen as one element or one dimension, or as two closely related elements. The two elements which are closely related, like two sides of a coin. So mental and emotional dimension were considered as two sides of a coin. Mental health can be seen as knowing or cognition. So mental health can be seen as knowing, but emotional health related to feelings or doing, which includes joy, happiness, sadness, anger, etc. Thus, which helps to control the emotions, thus maintaining the balance of the health or balance in the life. At present, experts in psychology have been relatively successful in isolating or separating and viewing these dimensions as two separate dimensions, like mental dimension and emotional dimension of human health. The emotion may have positive and negative, that may be high violence to low violence and high arousal to low arousal. An emotionally healthy person always have a positive thinking, positive attitude, and he is capable of coping and adjusting self. And he participates in all the activities which are related to his personal growth and his self-esteem. Next is vocational dimension. It is a new dimension and it is a part of the human existence. Vocational dimension is the part of our existence. Vocational dimension promote the physical health and mental health. So when physical work is fully adapted to human goals, capacities and limitations, it promotes both physical health and mental health. Thus vocational dimension helps for in improving the physical activity, goal achievement, self-realization, self-satisfaction and enhanced self-esteem of the individual. The importance of this dimension is exposed when an individual suddenly lost his job. So when an individual suddenly lost his job, he may come across a lot of problems, or he may face it with a mandatory compulsory retirement. Then there will be a problem with his daily life. In general, for many individuals, the vocational dimension may be merely a source of income, but for some others, this dimension represents the culmination of the efforts of all other dimensions as they function together to produce the life success. So it helps the individual to have a success in his life. The vocational dimension can be evaluated or assessed by facilities attached to the job. What are the facilities available in the job or working environment? Then behavior of the management, administrator or manager or the colleagues, co-workers at job. Then assessing the satisfactory level of the job. So satisfaction level at job, that is FBS, facilities, behavior of the manager and colleagues and satisfaction of the work, that is work satisfaction. Next is other dimensions. The seventh is other dimensions. I have made a mnemonic for other dimensions. You can connect this mnemonic to the previous mnemonic. The Prime Minister said to save others because of the scenario or situation in COVID-19. Now here the mnemonic is PSC entrance examination coaching to prepare the nurses to pass with the adequate knowledge and skill to tackle the pandemic situation in our country. So PSC entrance examination coaching prepare nurses to pass with the adequate knowledge and skill to prevent and control the COVID-19 pandemic. So let us expand the mnemonic. P stands for philosophical dimension, S stands for socio-economic dimension, C stands for cultural dimension, entrance stands for environmental dimension, examination stands for educational dimension, coaching stands for curative dimension, prepare stands for preventive dimension, nurses 2 stands for nutritional dimension, and pass stands for political dimension. Thus, other dimensions include philosophical dimension, socio-economic dimension, cultural dimension, environmental dimension, education dimension, curative dimension, preventive dimension, nutritional dimension, and political dimensions. So, these are the various dimensions of health. All these dimensions influence the health of an individual. So, to measure the health of an individual, you have to include all these dimensions. In short, there are many medical and non-medical dimensions such as social, cultural, educational, nutritional, environmental, etc. For example, the culture, which influence the health of the people by healthy practices of various culture, various traditions, various customs, etc. Then education. Education contributes to the quality of life. Educated people follow or obey the health rules and they follow the healthy practices. At the same time, illiterate people follow unhealthy practices which may lead to certain problems such as malnutrition with anemia, obesity, etc. due to lack of knowledge. Then in relation to nutritional dimension, diet play an important role in growth and development, which also promote and maintain the health of an individual. Then environmental factors, which influence the both inside and outside factors of the individual. Outside environment includes the physical, psychological, biological, chemical environment. Thus, all these medical and non-medical dimensions which contribute to the health of all the people to attain a level of health that will enable them to lead a socially and economically productive life. So let us summarize the topic. Today we have discussed about the dimensions of health. We have 7 major dimensions. I have been given mnemonic like a PM said, save others. Physical, mental, social, spiritual, emotional, vocational and others. The other dimension includes another 9 dimensions. The mnemonic you can connect with the previous mnemonic. Here it is. PSC entrance examination coaching. Prepare nurses to pass with adequate knowledge and skill to prevent and protect the people from a COVID-19 pandemic, which includes philosophical dimension, socio-economic dimension, cultural dimension, environmental dimension, educational dimension, curative dimension, preventive dimension, nutritional dimension and political dimension. That's all about the topic. So thanks for watching. Hope this video really benefits in your studies and exams. So if you feel it is worth and benefit, please like, share and subscribe my channel. Stay tuned with the Angel Health Academy till we meet with another important educational video. Thank you.